Assalamualaikum and hi, I am Siti Nurani Zahani. So in this video, my friends and I will present an assessment of functional status and quality of life. Functional status assessment is very important, especially in geriatric care and people with disabilities, since the list of difficulties or issues faced by the individual or medical diagnosis alone cannot well correspond to the ability of the individual to manage their daily routine. This assessment may help to determine the signs of illness or worsening of chronic condition based on the changes in functional status of an individual. Functional decline is contributed by some risk factors including pressure sore, pre-existing functional impairment, cognitive impairment, and low social activity. Quality of life, or QOL, is a measure of how much an individual appreciates the significant potential outcome of his or her life. The measure of quality of life also aims to provide more accurate assessment of individuals or population health and the benefit that harm that may result from the healthcare.
Assalamualaikum. My name is Nurul Azali binti Wazuki and I'll discuss my part on disease-specific quality of life instrument. And then I chose SGRQ, that stands for St. John's Respiratory Questionnaire, for COPD and asthma patient, developed by Jones, Quick and Babystock. And it's designed to measure the overall health, daily life and perceived well-being in patients with obstructive airways disease. And this questionnaire is self-administered. And patients experience numerous pulmonary and extrapulmonary symptoms such as dyspnea, cough, sputum, and other else. And all of these symptoms are responsible for their impact quality of life. And this questionnaire consists of 76 items that divide into three parts. Part 1 measures the frequency and severity of the disease. Part 2, any activities that cause or limited by breathlessness. And Part 3, that impact components that affect their social functioning and psychological disturbance. And the overall score is ranged from 0 to 100 score. 0 means no effect on the quality of life, 100 means maximum perceived distress. Thus, a higher score means a poorer quality of life. The Qol Brief alpha was 0.91. For domain score is more than 0.7. And test reliability was 0.77. And this questionnaire takes 8 to 15 minutes to complete, and it is best using computer to score. That's all from me, and I'll pass to the next presenter.
Assalamualaikum and hi, I'm Alia and now I'll be presenting the next part, which is the General Quality of Life Assessment Tool. For this part, we have chosen to use the WHO Qol Brief. This questionnaire is the simplified version of WHO 100. It consists of 26 questions, which fall from 4 domains. The 4 domains are physical, psychological, social relation, and environmental. Currently, this questionnaire has been translated and validated in 30 languages, including Bahasa Malaysia. For the physical domain, there are 7 phases included, which are pain and discomfort, energy and fatigue, sleep and rest, mobility, activities of daily living, dependence on medication and treatment, and the last one, work capacity. In the psychological domain, there are 6 phases included, which are positive feelings, thinking, learning, memory and concentration, self-esteem, bodily image and appearance, negative feelings, and spirituality. For social relation domain, there are only 3 phases included, which are personal relation, social support, and sexual activity. For the last domain, which is the environmental domain, there are 8 phases included. The phases are physical safety and security, home environment, financial resources, health and social care for accessibility and quality, opportunities of acquiring new information and skills, participation in and on leisure activity, physical environment, and transportation. To use this questionnaire, we should ask for permission from the National Field Center. All the questions must be asked according to the order given from the examples set. This questionnaire can be done by self-administered, but if the respondent have difficulty in reading, interview-based can be used. For the scoring system, all the scores are given according to the phases in domain. All phases are in positive manner, which are the higher the scores are, the higher the quality of life, except for certain phases which are pain and discomfort, energy and fatigue, dependence on medication and treatment.
Assalamualaikum, my name is Nur Akila. I will continue the presentation with a self-rated instrument for functional status assessment, which is CATS Index. CATS Index of Independence in Activities of Daily Living, also known as CATS ADL, is the most appropriate instrument for assessing functional status as a measurement of the client's ability to perform activities of daily living independently. Clinicians typically use the tool to detect problems with daily activities and plan care accordingly. The instrument is most effectively used among older adults in a variety of care settings when baseline measurements taken when the client is well are compared to periodic or subsequent measures. The index rates performance adequacy in 6 functions, which consists of bathing, dressing, toileting, transferring, continence, and feeding. The client's independence in each of the 6 functions is graded as a yes or no. A score of 6 denotes full function, a score of 4 denotes moderate impairment, and a score of 2 or less denotes severe functional impairment. The CUTS ADL index evaluates basic daily activities. It does not assess more advanced daily living activities. Although the CUTS ADL index is sensitive to changes in declining health status, it is limited in its ability to measure small increment of change seen in older adult rehabilitation. When necessary, a full comprehensive geriatric assessment should be performed. The CUTS ADL index is very useful in creating a common language about patient function for all practitioners involved in overall care planning and discharge planning.
I'm going to talk about on the objectively measured instrument, which is hand grip or hand dynamometer. So this hand grip strength, we have 4 types which is involved in based on principle. So for first principle is hydraulic. So hydraulic example type of instrument used is jammer, and then followed by pneumatic. Pneumatic example of instrument is multivibrator. And then as for the strain principle involved in isometric strength testing, hard pendant is used for the mechanical principle. Okay, let's focus on jammer instrument. So we highlight on the jammer instrument because it's the mostly used in most of the assessment studies, which is a gold standard method. So these jammer instruments, the measurement value based on kilogram or pounds of force, and these involve in a hydraulic principle where this system enables the grip strength to be read off a gauge dial, as we can see in the picture. So in terms of reliability and reproducibility, so the reliability and the reproducibility of this instrument is very starting from the range of good to excellent. Okay, in terms of assessment, it's better used to assess among sarcopenia, and also even some tested for the athletes as well, sports athletic. So due to this instrument actually can provide a consistent measurement value.